Hi Andy, how are you?
I'm doing well, thank you.
Excellent. So tell me, what is your main concern and the reason you want braces?
I've been very self-conscious of this tooth here because it sits up a bit higher than the others, and when I'm resting it looks like I'm missing that tooth.
Okay.
And some of my bottom teeth are a little bit crooked as well, and
Okay.
it just doesn't feel as comfortable as I think it could.
Perfect. Yeah, I can see when you talk that the level of the teeth is a little off. So I will for sure get them all aligned.
Perfect.
Give you a nice level, so when you smile you see a nice line of teeth.
Good.
Rather than one higher than the other, one in front and the other behind.
Perfect.
Would that make you happy?
Yes, very much.
Fantastic.
Thank you.
So what I like to do before I start, I like to put you back a little bit, if that's okay. Want to take a look and see how your teeth look and how the bite is, so I can make some decisions what brackets are going to be used. I know that you want the cosmetic brackets, and we're going to be using a ceramic bracket that I am testing right now for better features, so I can put it up to all my students.
Okay.
I think it's a fantastic bracket. I just
you.
got to develop it. And then we clean your teeth and start putting your brackets on.
Perfect.
Does that sound good?
Yes.
Fantastic. Okay, Andy, we're going to take a look at your teeth. I want to see what's there, what type of bite you have, and then we move on and polish your teeth and put your braces on, okay?
Okay, thank you.
Can you open up for me, please? Now I need you to close a little bit. Thank you. All right, turn away from me. So we're looking at a class 1 canine and molar relationship with the first bicuspids missing. But on the front I can see the crowding and the different level between your central and central incisor, with the lateral being higher than the central. I see that. And that's what's bothering you, right? And then we have a little bit of crowding right here at the bottom. And I'm looking at your gums. Let me pull your gums a little bit in here, your lip a little bit. I just want to see if there is any blanching of your gum tissue when I pull, to see if the quality of the tissue is strong enough to support your braces. And now can you bite down for me and turn towards me all the way? And again, on this side we also have a class 1, and you also have 2 bicuspids missing. So we're doing pretty much a revision of the treatment that you had previously, right? To realign the teeth. Now you're going to have to promise to wear your retainers, okay?
I will.
All right, thank you. Cool. So I'm going to start polishing your teeth now.
Okay.
The reason I have to do this even though you just had a cleaning is because I want to make sure that there is no film over your teeth, so the brackets bond properly, okay?
Okay.
And we use pumice with no fluoride. I don't want fluoride on your enamel when I'm going to be bonding your teeth, because it will make the bonding surface not as good. Alright, so I'm gonna, now we can see the polish, okay? This will give us a fresh surface to put the brackets on. I know you're going to have a lot of sand on your teeth. Once I've finished polishing your teeth, we'll go ahead and let you get up and rinse really good, okay? Doing okay? Good.
Yeah, because it's a different color. Yes, it is. Okay, I just want to make sure I wasn't doing that.
I think we're good. check if I should put more comments. All right, all set. Let's wash you out. What's the water, dear? Showers in the house. All right. And I'm setting up using the IP bracket placer or bracket holder, which each one of them has a gauge for the height of the bracket in the back, and this way, by using these holders, I can have all my brackets set up with the right height, so I don't have to be changing instruments as I go along. Another thing that also it's a good thing to have with this bracket delivery system, it tells you how to hold the bracket, what goes changeable. That way when you're in the mouth, you don't have to be twisting your hands to try to get the right height. So I like to have everything set up before I start. So once we start working, I just can have my assistant pass me one bracket after another without stopping, making my bonding process a lot more efficient. Now, for video purposes, I am setting this up right now, but this typically should be set up for you by your assistant as you are doing something else more productive. Your assistant can be preparing all this setup for you, and the only thing you have to do is come back to the chair and start your bonding process. All the prescriptions heights are pre-printed from the IP soft after doing the full exam and evaluation on the patient. So the assistant knows which bracket holder to use, as the bracket holders indicate different heights. I am using a standard height on Andy, and I'm just following the prescription that I have printed right in front of me, so I don't have to think much about what I need to do. Makes the process a little faster and easier. After the patient has been prepared with the polishing, we'll retract the cheeks. I recommend the FlexiBond retractors, which actually give you enough retraction so you can approach the second bicuspids directly without having to come on an angle. Open up a tiny bit for me, and again close a tiny bit for me now. Thank you. Now I need you to leave your head for me so I can wrap up this strap behind you. Close a little bit and just relax your cheeks. Thank you. Beautiful. Now I have beautiful access. Turn away from me. So when I come into the second bicuspids, I have direct access to the bicuspid rather than coming in an angle and having more difficulty placing the bracket. I always use 2 saliva ejectors. Open up for me and bite down in here. And having the patient bite on the saliva ejector allows me to have just the right amount of opening that I need. I'm going to put this cotton under your lip. Thank you, sweetie. And keeps the mouth dry at all times. So we're going to bond the upper arch, and then I'll show you how I prepare the lower and what I do to keep it dry. So first thing we do is we're going to put some etching. So I like to apply etching gel on the teeth rather than the liquid, because with the etching gel, when I rinse, I can clearly see that all the etch gel, it's washed, and I don't have a question. Also, it gives me a little more control where I'm placing the gel. You don't need to etch the whole tooth, just the area where the bracket is going to go. So just a little bit of etch on each tooth. The standard phosphoric acid etch. And once we have all the teeth treated, then we just give it 20 seconds for the etching to take effect. And then we rinse and thoroughly dry. Now we're gonna just to the high volume to maintain things dry. I just come close to the teeth. That way the whole mouth, not even my cotton rolls, get wet. By putting the saliva or the high volume suction right next to the teeth and pointing the water stream to the high volume, you don't have to be changing cotton rolls. They never get wet by doing it this way. And then it is important that your three-way syringe really blows only dry air. There's a little bit of etching here, so that's why I use the gel rather than the liquid. And then with a three-way syringe that is just blowing air, we dry the teeth. And from this moment on, we do not touch the teeth. You okay? Mm-hmm. So the next step will be to place the bonding agent. On the teeth. And we will apply a very thin layer of bonding agent on the teeth. Make sure that you don't apply a thick layer. So you want to have a very thin layer of bonding agent. So I dip my brush, and this carries a big drop of it. So I take the excess right on the plate where I'm grabbing my bonding agent, and I paint a very light coat of bonding agent. As you can see, I painted 2.5 teeth with just a tiny bit of bonding agent. Now we can start the bonding process. All the brackets must also be prepared with a very thin layer of bonding agent before the cement is applied to the brackets. So now the teeth have not been touched, and as you bond, please avoid touching the teeth as your gloves will contaminate the tooth surface, and you're not going to be able to bond. So your assistant is supposed to pass you the brackets as you go along. You place the bracket, and once it's set, you just hand back the instrument and ask for the next bracket, and you go that way. So I place the bracket using my bracket holder, and then I just change to the side of the gauge and make sure that the bracket is in the right angulation and at the right height. I use a sickle to remove any excess cement that I may have. Quick confirmation of my height and placement. Next. For a change, I don't get a million. I go to the next tooth. The canine has a different height, and that's why I use the IP bracket delivery system. So right here I'm checking my height, and at the same time I'm making sure that I have the bracket in the right position and angulation, followed by a quick clean of the excess cement. And then next bracket, please. The lateral also has a different height, so this will be 3.5 millimeters. And as I place the gauge, I make sure that I have the right angulation of the tooth, parallel to the long axis of the tooth, and parallel to the incisal edge. A quick clean of the excess cement. Next, please. You don't want to use light cure cement on ceramic brackets, because the bonding strength of a light cure cement is too high, and bonding ceramics with a light cure cement will be the equivalent of bonding a veneer. So right here we're just using a soft cure cement. That's why you don't see curing lights. Next, please. Thank you. But this cement allows you enough working time to set up the bracket exactly where you want it, make adjustments as needed, and even come around and clean the excess cement. Notice that even though I'm using both hands, I am not using my finger support on any of the teeth that have been prepared. Touching the tooth with my glove will contaminate my bonding area, and I guarantee debonding. Also make sure that your assistant does not put too much cement on the bracket, or you would have tremendous amount of cleanup to do. The more you have to clean, the more are the chances that your bracket will move and it will end up in the wrong position. Something that's very important, and I don't know if you guys have noticed, I put quite a bit of pressure with the bracket on the bracket against the tooth to really get as intimate a contact as I can, so the bracket does not move and I really get the right amount, the right prescription. If you have too thick a cement, first of all, your bracket will move all over the place, and you will have a very thick band of cement that will change your torque of your bracket. So make sure you put firm pressure with your placement instrument against the tooth. So the bracket doesn't slide everywhere. Open up a tiny bit for me, dear. And let's change this so I have a good direct access into your other bicuspid. And last bracket can go with me, dear, a tiny bit. Thank you. You see me standing up, and the reason why I stand up as I work on the left hand, I want to have direct vision to the tooth, and if I'm sitting down, even if the patient is turning her face towards me, I might end up with an incorrect bracket position, incorrect height, and will end up develop an ugly hand that will require either a lot of wire bending or me repositioning all the brackets after alignment. At this time, the upper arch has been fully bonded. Those colors on the bracket will go away as I wash the teeth. And now I just proceed directly to prepare the lower. For video purposes, I chose to do the upper and the lower arch in 2 stages. Typically, in the office, we do both arches at the same time. For the lingual side, what I do is I just put 2 2x2s together. I make a little roll. Then I ask the patient to lift your tongue, please. Open up a tiny bit. And then I just put the 2x2s under her tongue, and that will keep the saliva flowing from the sublingual glands in check. And the preparation of the teeth is exactly the same as with the upper. Put some edge on each tooth. And notice that I'm not bathing the teeth on acid edge. I'm just putting a little drop of acid edge in the area near where the bracket, in the area where the bracket is going to go. I don't want the whole tooth edge. It's not necessary. And once the edge is done, which one? Okay. Once we're done etching, again, we count about 20 seconds for the, let me put a little more on this bicuspid, for the edge, the acid edge to etch the enamel. And then again, we'll follow the same procedure. And again, I put the suction right on the tooth, better when it's on, right on the tooth, so I don't have all the water making my cotton rolls all wet and then have to change cotton rolls and so on. Now keep in mind that this process is done by the assistant, and once the patient is ready with all the teeth prepared, etched, and with the initial coating of bonding agent, then it's when you come to the chair just to cement your brackets. still have a little option there. Little. Now I just put my suction over the gauze, and the gauze is dry. And we make sure that the teeth are dry. I want to see that frosty look on all the teeth. Now we're ready to start the bonding process. Remember that we always start at the second bicuspids when we bond, because that is the shortest tooth in the mouth. And many a times, even though we have a pre-selected height, if the tooth is too short, we may have to make adjustments to that height. If we don't make those adjustments, you will end up with a cant on your occlusal plane as well, or a possible posterior open bite. You will lose control of the vertical. So always remember, we start with the second bicuspid. So again, right to left, please. Oops. Please notice that even though I'm using my left hand for support, I am not putting my fingers anywhere near the teeth, using the height gauge. I position my bracket at the desired height. Little adjustment here for the angulation with the end of the and a quick check for the height. That is correct. So then we move on to the next bracket. And I can just refine the planing if necessary while the next bracket comes to my hand. Notice how beautiful access I have to the FlexiBond retraction system. There is no other retraction system that offers this. I did not have to come in an angle and then reposition my bracket. And that allows for more precise bracket placement. Okay, yes, let's do this. I'm at the right height. Next. So now I just confirm my height and position, and can I have the next bracket please? Huh? Sorry, I put that in here. Thank you. Keep in mind you want to press the bracket really tight against the tooth. And here to the height gauge. make sure that the bracket is in the right place. Next, I need you to kind of tiny bit towards me. Thank you. And we continue bonding. Now we're at the canine. You're going to have to make a cut. And again, using the gauge, we make sure that we have the tooth at the right height. And then I look from behind the patient and above and to the right. I get up a little bit to make sure that I have placed the bracket in the right position. Okay, next. As you notice, I'm using also the back of the gauge. Sometimes I use it to help me push the bracket into position, allowing me to see, have a better approach to the tooth. And also to get the correct angulation. So I check and clean the excess cement. And and the bonding process is complete. At this time, we take all the cotton and the retractors. Raise your head for me. Thank you. I'm sorry. And we allow the patient to clean and rest. As you can see, I clean up most of the color on the lower with a Profi cup, but when the patient rinses, it's going to look kind of like what you see on the top. And then if the patient just gets off the chair and brushes her teeth, if not in the first time, the second time all the color will be gone. So we're going to place an 012 nickel titanium alignment arch wire. And one of the things I'm going to do, I place the wire and I hold it with my fingers, and then with a Sharpie marker, I mark distal of the bracket of the bicuspid on both sides. So I can put a bend right distal of the bracket of the wire, and that will allow, give patients some comfort. Now I have pulled the wire and I can see the dot right here where the plier is holding. So right at the dot, I would grab the wire and I would just turn. And you can see, even though this is nickel titanium, the wire undergoes permanent deformity. So you want to turn your plier about 180 degrees. You just want to turn it, and that will give you a little 90-degree bend, so the patient will be more comfortable and the wire will not be sticking out, cutting her face or her cheeks. So you can see the little bend. And we do the same thing on the opposite side. So again, I'm going to remark. Sorry. Okay. You can have your assistant mark for you, because you have to hold the wire in place. And here's my mark. And I hold right at the mark. Can you see that? And then with my plier, I will twist the wire about a full turn, really a nice twist, to produce this little bend. Then I can cut the wire, and the wire will be pointing towards her teeth. And we just seat the wire back and make sure that our bends are correct. You want to have, no, let me show you. You want to have your assistant, can you see this? Pass you the ligature with a little bend. So when the ligature is passed to you, can you grab it right here? Right here. So when the ligature is passed to you, you just grab it, and then you can slide it onto the bracket. Now, once you have the ligature slide onto your bracket, use your middle finger and twist your hand, and you start the twist. Put your fingers over the bracket so it doesn't loosen up. Grab close to the bracket so you don't have to twist a million times, and your first bracket, it's tied. Again, the assistant passed me the tie already pre-bent, and I just slide it over the tooth, twist my fingers, hold, and tie. If for any reason your assistant, which is actually the person that should be doing this, does not have an assistant, you can have your patient, bring your hand closer, you can have your patient hold the ties for you, so your assistant can just grab the ties directly from the patient's hand. Now, notice I tend to put my finger over the tie that I just placed, just so as I grab my wires, my pliers, I make sure that the tie is not going to come off that bracket. And again, just slide it through. Turn away from me a tiny bit. Just slide it through. Twist your fingers, and you have your tie. I typically hold it with my finger right on top of the bracket. Grab my Matthew plier and twist. The rotation of the pigtail goes towards the rotation of the tooth. If the tooth is mesially rotated, you want to have the pigtail, like I'm doing here on this bicuspid. Turn away from me. Like I'm doing here on this bicuspid, you want to have the pigtail pointing to the mesial
Or said another way, where the wire is farther away
from the bracket. In this case, we have a slight mesial rotation. So one of the things I like to do, you have a ligature director?
No, that's it.
I like to either with a ligature director, or in this case with a dirty sickle. With a sickle, I push on the wire so I get full deflection of the wire into that bracket slot and finish twisting. And now I have this wire totally activated. We move to the next side. All right, how are you, dear?
Good.
Where's my bracket, my wire right here? I'm gonna go ahead and put the canine. So the tying process is not a complicated one. Just make sure that you keep your pliers not too far away from the tooth. I always keep twisting the excess wires so they are not on my way, and by putting them all together, I don't have to worry about picking one wire at a time when we're cleaning up and cutting the excess ligature ties. There you go. You can see my finger holding the ligature so it doesn't move while I'm grabbing the ligature with my pliers. I put all the ligatures together. As you can see, in this case I made a little knot in here, and now close tiny bit. Put my fingers in there to protect the patient from being poked with the ligatures, and I cut and push the ligature out of the way. So if you train your assistant to do this, then she can work by herself without having anyone else in your office having to sit on the chair while wires are placed or changed. Then make sure that the excess ligature ends up on your sharps disposal, and you can use the tip of your Matthew plier to push all those pigtails away from the bracket, from the teeth behind the bracket, or at the same time as you're cutting, you can just snap, and with your pin and ligature cutter, you snap, and at the same time you push the little pigtails. All pigtails should be pushed towards the tooth, as they can be really sharp and irritant to the lip, to the point that the patient is not going to be happy. So this is the upper arch, fully tied, and then we'll repeat the same process on the lower. So now for the lower, the wire has been precised using her study models. You don't want to come in with a full wire that will end up poking the patient back in the throat. I'll sit the wire, hold it with my finger, and make a little mark distal of the bracket, and we'll do that on the other bracket. I bring the plier out, I hold the plier again at the dot, not using the tip so it doesn't come out of your hand, and bend really tight, and you will have a definite bend on your night eye. Sorry.
That's right.
Then I just cut behind that bend, and we get a little like an L shape bend that will hide behind the bracket, and it's not going to hurt our patient. I place the wire again to confirm that my bend is in the right place, and then we go ahead and just, you can have your assistant grab the wire exactly where you want to and bend it for you. We got right distal of that bend. And now we can start tying our arch wire. With this patient, she has teeth that are pretty straight, so there is not a lot of difficulty. But there are situations where you have patients with severe crowding. You want to secure the wire. When you have situations like that, you want to secure the wire on one of the teeth, and then you want to tie the most crowded tooth first, and then followed by the easier teeth, as you will have more wire flexibility to do that. So on this side, you can see that the lateral incisor, it's a little behind. So in order to if I tie the lateral and then the canine, I will have less wire flexibility. So at this time, I'm gonna go and tie that lateral incisor. Since the tooth has also a mesial rotation, I will place my pigtail towards the mesial, where there is more deflection of the wire. The pigtail is placed towards the mesial with the objective of having the tightest part of the tie towards the rotation. Notice how I use my sickle to push the ligature tie very tight against the bracket, so I don't have any slack. Now we just pass our ligature tie and start twisting. I'm doing this left-handed so they can see, but I can't because I don't want to break the brackets. Open up a tiny bit for me. You can have your assistant push on the wire, push hard, to get full engagement. This is a very light wire, and then your tie is complete, and hopefully you can notice the deflection of that arch wire. So secure the wire and then go and tie the most difficult teeth. You can push with your nail like I'm doing in here to bring the tie close to the bracket. You don't want the distal aspect or the loop aspect of the tie to be too far away from the tooth. And now we just proceed to tie This lateral also has a small mesial rotation, so the tie also goes towards the mesial. I want to make sure that that tie is tight, so I push. Now, with the sickle or a ligature director, we push the wire towards the bracket to gain full engagement. You do not want to have your pigtail or your twist try to push the wire. Don't attempt to push the wire like that, because the wire does not get enough deflection. There is not enough force, and you don't get enough deflection, and it will take you edges to be able to fully derotate that tooth. use either a ligature director or a sickle so you can efficiently get that tooth derotated. Also, this cement, even though it's hard within the first 8 to 10 seconds, it really takes time to fully cure. And if you are stressing the bracket by trying to bring the wire in with the pigtail by putting force, you might end up debonding your bracket. So it is much better idea to push the wire fully with an instrument and then just tie. Okay. That'll close her bite. That step will close her anterior open bite. Now you've seen me after every tie grabbing the plier. Sometimes if you want to tie faster, you can just secure the tie with a couple of twists and then get the next tie, have it ready, and secure the next one and go along that way and then tie each individual tie. That is another way to do it. It is up to you. I prefer the method of fully tying a tooth at a time. But if you like to do secure all the brackets and then, just like I did right now with these last two brackets, and then tie the rest of the teeth, that is also okay. We make sure that we have all of the wires together so we don't have wires all over the place. You know, we put them on a little bow. And then, turn away from me. You can cut and push. Make sure that your tie is not, your pigtail is not very long, maybe 2-3 millimeters, so it doesn't end up poking the patient's gum. You want to push that pigtail tied against the tooth towards the contact so the patient can brush. Now I said can floss. I said towards the contact, not into the contact. So we cut the ties short, maybe 3 millimeters long, and we push it towards the contact, nice and tight against the tooth. We don't want the tie poking the patient's papilla, and we don't want it to stick out, or the patient will not be able to floss. You saw me using the end of a sickle to push those two ties because the contact is very tight in there, and my plier may just torque the bracket and break the cement because it's too thick. So, like on this case, I would use a thinner instrument like my sickle. You can also use a ligature director and push the wire towards the contact. There you go. And now we just pushed in the last two pigtails. And you can see that just with the time that we have spent tying the wire, most of the color, it's gone. So no carnival for you.
Yay.
So at this point, we're done with the bonding of the upper and lower 5 to 5. This is the time where the patient gets oral hygiene instructions, where the patient gets flossing instructions, and then we'll see the patient in 6 weeks.